What is scarless breast augmentation? Can implants be put in ways that don't create a scar on the chest? They can. So when you do a breast augmentation, most people typically only know one way. What do most doctors do? They make an incision along the inframammary fold or on the bottom of the breast. They make a cut about 4, 5, 6, 7 centimeters, and they put their implants in there, either saline or silicone. Now there's some times where that's the only approach you can use. But you know what? There's better ways to do it many, if not most times. Now, many or most times you can put the implants in through a way that doesn't create a scar on the breast. What is that? Well, the number one way I often do implants that doesn't involve putting a scar on the chest or doing it scarless on the chest is going through the armpit. Now, a lot of patients tell me, hey doc, is that going to hurt more? That's weird. I don't know about it. I read online that the implants could look crooked or not be right. Well, in my opinion, that's only true for somebody who doesn't know what they're doing. Sometimes you go to a doctor, they have no experience doing implants through the armpit, and they'll be like, oh yeah, it's going to settle crooked. Oh yeah, that's not possible. Oh yeah, that's not going to work. What I would tell you is ask that person if they've ever done it. A lot of providers are quick to dismiss something they know nothing about, they don't know how to do, so they don't lose that patient and they don't look or feel dumb. In my opinion, that's the wrong way to go about it. So when somebody wants breast augmentation through the armpit, you can do it. In my opinion, with my patients, it hurts less, they recover quicker, and I can give them more cleavage and make them more even oftentimes. So how does that work? So when you go through the armpit, we make a small incision and make it about 3 centimeters through here. Now I've done the biggest silicone implants they make through the armpit, 800 cc's. Small incision, I don't put it here, I don't put it here, I put it here. I use a crease that's deep in the armpit, so when it heals, it just looks like that crease and you're not going to really see a scar. When you go through the armpit, the patient's sitting in the OR table with their arm like this. So instead of cutting the muscle, I'll make a small incision in the crease and then I'll lift the muscle up. See, I'm lifting it up, then I'll use my special custom-made tools to make the pocket by lifting the muscle up. Now, people who don't know armpit technique or scarless breast augmentation, they'll push too much to the side and the implant will end up in the armpit. That's the wrong way to do it. So I make a pocket underneath the muscle, keeping the muscle intact. The advantage is there's literally no scar on the chest. This scar you can't even see because I'm not cutting the muscle. My patients often say it hurts way less. The other advantage is when you look at two arcs side by side, one that's through the fold, one that's through the armpit, the one through the armpit always looks a little rounder and nicer, in my opinion. Why? Because when you don't cut the fold, you don't violate the inframammary fold or the attachment. You're stretching it and releasing it, and it stays rounder and it looks way more natural. You also get a total submuscular insertion. What that means is, in my opinion, you're going to get less sagging, it's going to look perkier, it's going to look fuller. So scarless breast augmentation is totally possible. In the right patient, I think it works better. Cutting the fold is not the only way. If someone tells you that's the only way, or that's the best way for everybody, they don't do enough breast augmentation. Everyone who does a lot of breast augmentation knows every patient is different, every approach is different, and the procedure and surgery has to be customized to give the patient the best result.